The government pressured Canadians into taking an experimental pharmaceutical for a virus it helped fund in research, deployed military-grade propaganda against dissenters, and is now burning through millions in taxpayer dollars on a compensation program so broken that the injured are being left to suffer in silence. In December 2020, then Prime Minister Justin Trudeau announced the Vaccine Injury Support Program, or VISP, a no-fault compensation scheme meant to support those who suffered serious and permanent injuries from Health Canada approved vaccines. But a 5-month investigation by Global News reveals that the program has become a bureaucratic nightmare, leaving victims in limbo, drowning in debt, and questioning the very system that claimed to protect them. Despite decades of calls for a vaccine injury program, something every other G7 country already had, Canada hastily pieced one together during a crisis, and then outsourced it to Exaro Inc. The result? Of the $50.6 million spent so far, a staggering $33.7 million has gone to administrative costs. Just $16.9 million has actually made it into the hands of the injured. In other words, for every dollar paid to someone injured by a COVID vaccine, nearly 2 were spent on bureaucracy. And it gets worse. Exaro and the Public Health Agency of Canada grossly underestimated the number of claims they'd receive, predicting just 40 valid cases per year, later bumped up to 400. In reality, over 3,000 Canadians have filed claims. Nearly 1,700 are still waiting for a decision. Many can't even reach a case manager and are left to crowdfund online just to afford medicine and mobility devices. Some have had their claims rejected by doctors they've never even spoken to, faceless panels making life-altering decisions without so much as a phone call. Just ask Becky Marie Campbell, a healthy school teacher and mother of 4. Becky was left unable to walk just 3 weeks after her COVID shot in April 2021. She was hospitalized, then subjected to a psychiatric evaluation simply for asking if her condition might be linked to the vaccine, and later discharged in a wheelchair. Her own physician said the illness was most likely related to the shot, but VISP's anonymous panel said otherwise and denied her claim. She never even got a call. For many like Becky, the money isn't the point, it's the betrayal. Canadians were told this was safe, rare, and necessary. When it wasn't, they were told they'd be supported. Instead, they were ignored, dismissed, and left behind.